Good morning. Very pleased to have present in her office here in Southern California, Dr. Heather Roberts. Thank you for having us, Doctor.
Thank you for having me.
And she's active in the USC Keck School of Medicine, and as well as UCLA, while maintaining obviously a very, very busy clinical practice. She's nearly a decade or so, since 2013 with InMode.
2013, yes.
And she's probably the most experienced clinician with the IPL technology developed by Mishka Krendel, the CTO of InMode. And she has tons of experience. And
Great. Thank you so much for inviting me, Dr. Chia, and thank you to InMode, and thank you to all the participants that are logging in today on a Saturday morning. So today I'm going to share with you why I love Lumecca and why it's become truly my favorite procedure. Next slide. So I think it's really important to understand the basic science behind every treatment that we're doing. So, instead of just memorizing tables and trying to plug in numbers without knowing what you're doing, it makes it a lot more fun to customize your treatments for your patients. And as you get comfortable with the settings and knowing what they mean, then you'll know how to adjust your settings to give your patients the great results that I've been getting for years. So IPL, or intense pulse light, basically, why do we even talk about the difference between IPL and laser? So 20 years ago, I sat in on conferences where, we couldn't even believe that anybody thought something like broadband intense pulse light could actually work, because we had been so trained that, laser is one wavelength, specifically targeting one chromophore in the skin through selective photothermolysis. Well, then when this concept of broadband light came in, now we can target not only brown spots, but red spots, as well as hair follicles, all at the same time with the same pulse. Next slide. So, sometimes the laser physics terms are a little bit daunting, but we're going to go over some of those terms just to make it a little bit more understandable. So anytime light shines on the skin, light can either be reflected or transmitted through the skin. There can be scatter, and then there's absorption. So we're trying to take advantage of, setting our device in a way that we get absorption where we want it to be and not where we don't want it to be. Next slide. So light travels in a wave, and so basically wavelength is the distance between two peaks of that wave. And so if you have a shorter wavelength like you see in red, then that wave is moving very quickly at a high frequency, but it's not going to penetrate as deeply into the skin. So when you're trying to target things that are more superficial, like superficial epidermal pigment or superficial blood vessels, you're going to be using that shorter wavelength. Conversely, if you have a patient with a skin type where you don't want to target epidermal pigment because you don't want to knock out all of their baseline pigment, then you're going to choose a longer wavelength laser, which is going to penetrate deeper and get past some of that superficial pigment to get into those deeper blood vessels, as well as the deeper pigment. Okay, so we're going to move on to the next slide. So this is always kind of an overwhelming, daunting slide, but we're just going to focus on a couple of things that will make it very simple. So again, when we talk about absorption of light in the skin, we're looking at something called the absorption coefficient. And so a chromophore is basically a color-absorbing molecule that will absorb a particular wavelength of light. And that's why you keep hearing me going back to wavelength, 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 because that's really, with this device, your main setting point. So the chromophore is our target. So that target might be melanin, it might be hemoglobin, it might be water, collagen in various lasers. But with the Lumecca IPL, what we're really mostly targeting is melanin and blood vessels. So if you look at this chart, and you look at the melanin curve, which is the diagonal line in black, and you go over to the left side of that graph, and you see at a very low wavelength of 300 nanometers, you've got your maximal absorption of the light by the melanin in the skin. So as you go to the right, then in a logarithmic scale, that absorption curve is gradually decreasing. So as we get out to longer wavelengths, to 1,000 or greater than 1,000, the amount of melanin absorption has decreased significantly. The other thing to look at, which is really important, is in that section between the 700 and the 1000 nanometer, you can see where the black line is for melanin is much higher up in the absorption percentage, whereas the hemoglobin, the oxyhemoglobin and the water is much lower. So you're going to be able to preferentially target that pigment by getting the majority of that energy absorbed by your pigment producing cell in whatever pigment structure you're trying to target. So again, the biggest point I would just like to make over and over again is really understand wavelength. And I think if you just memorize that melanin curve, you don't even have to memorize any of the others. I draw that curve for patients all the time, explaining to them why we're using different settings. And so again, shorter wavelength, higher absorption of melanin, longer wavelength, less absorption, and shorter wavelength, less penetration, longer wavelength, deeper penetration. Next slide. So there are different ways to classify skin tones. We're all familiar with the Fitzpatrick classification, which really, judges someone's response to 30 minutes of sun without any sun protection. But I think it's also really important to take into consideration ethnicity and genetic factors. Next slide. So we can see here on this ethnicity scale, Caucasian has a broad range, just like, other skin tones have a range from, lightly pigmented, medium to much darker. But within the Caucasian range, someone who's Celtic versus someone that's Mediterranean have a very different propensity for hyperpigmentation after a treatment, as well as just, their baseline pigment for safety reasons and not getting rid of their baseline competing chromophore of their skin tone. This procedure is not for darker skin, type 5 and type 6 skin. And if you think again about the melanin curve, they have a very high concentration of melanin in their skin. And so even shifting to the longer wavelength, there's just too much competing chromophore, and you can definitely permanently hypopigment a patient. Next slide. So this is a slide just kind of to hammer in again the same concept. So, 20 years ago when I had my first device and we had little plastic colored filters that I'd have to slide in and out literally for 100 pulses, in and out of a handpiece for every single treatment, and use multiple filters, we were looking at these multiple levels of filter cutoff. InMode has made it much simpler. Now it's already built into each of the handpieces. So we have a 515 handpiece and we have a 580 nanometer handpiece. And so all you really have to do is, again, figure out your patient's skin type. And for, your type 1s and 2s, you're going to use the 515 for most of your treatments, and that's a great starting point. For some of the type 3s, I'll use a 2 sometimes, for some of the type 3s, sometimes I'll use a 515, other times I'll use a 580. Again, depending on if maybe I'm trying to target something a little deeper in the skin or some type of a blood vessel. Next slide. So what is it about Lumecca's IPL that's so special? So, we like to say it gives laser-like treatments. I mean, it has a great peak power and a very short pulse duration. And those two things are really important because the bigger challenge is the vascular lesion. I always tell my patients to think of a blood vessel as a living, breathing structure, whereas pigment is like a little ink stain in the skin that we can easily shatter. And again, remembering that absorption spectrum, melanin is going to absorb more of the energy. So years ago, when I had a prior generation IPL device, it was not uncommon for me to do an IPL and then, after a couple of treatments, have to bring them back and do a pulse dye laser treatment to clean up any residual telangiectasia. So I don't have to do that anymore. So now I have one device that I can adjust my settings within the device, and I can target red and brown and get really effective results. Again, we've talked about the cutoff filters, the broad spectrum, the repetition rate you'll see when we're doing the treatment is very rapid. And so, I mean, I've heard some people say they can do a full face in 4 minutes. I can't, I'm not that fast, but it definitely is much faster than a lot of the other devices. And just the mechanics of the handpiece, I have a small hand, it's very comfortable in my hand. I don't get hand fatigue at the end of the day. It's a finger trigger as opposed to a foot pedal for the Lumecca. And it doesn't have a very big footprint in your office. It's easy to store. So again, just some of the company's parameters. Next slide. So again, the Lumecca has this nice, elegant handpiece. It has a very large spot size. So it's 1 centimeter by 3 centimeters in that sapphire crystal. And you'll see how I march that across with very tight overlap so we don't skip any areas across any area that I'm treating. So I really never do spot treatment with Lumecca for a couple of reasons. One is I not only am targeting blood vessels and melanin, I'm targeting collagen. I'm trying to get some diffuse heating in the skin to get a little bit of collagen stimulation. Some patients do find their skin feels a little smoother. Some find their pores are a little bit tighter. So we want to get a full region treatment. We also, depending on what part of the body we're on, so when we're treating arms and sometimes even chest, you can get footprints. So especially if someone has, a lot of sun exposure on their arms and chest, you need to do very tight overlap so you don't see stripes of where you treated and where you did not. And we'll talk about that while we're doing the treatments. You get a range of choices on your energy from 5 to 30. We'll talk about the settings. And then pulse duration. So pulse duration is the time over which you're delivering your pulse. So a shorter pulse duration is going to be more aggressive. I think of it as kind of like just throwing the dart right at the target of your bullseye. And so it's just hitting it, it's shattering it, you're done. Very quick, in and out. If you have a situation where you want a longer pulse duration, and we'll talk about why you might choose that, think of it as a more gradual heating of a blood vessel and then a gradual offset. So it's a slower heating when you've got someone with a darker skin type and you're trying to be a little bit more gentle on their epidermis. That's a nice way to just gradually heat things up. So again, you don't cause any dyspigmentation or hypopigmentation. And then cooling, the sapphire tip, the cooling is fantastic. There's circulating water through the tip continuously. It really feels like a nice cold piece of ice on the skin. I mean, I've done treatments on myself and on patients without numbing. I typically do let my patients numb just because some patients get a little bit anxious. But this absolutely can be done with or without numbing, depending on what part of the body and a patient's sensitivity, as well as how strong a setting you're going to do. Next slide. So this is one of the original studies that Vic Ross and Michael Crendel did, just really, again, emphasizing how powerful this device is. And I have to say, I mean, it's amazing to see how quickly blood vessels can clear with this. Between the short pulse duration and that high peak power, patients will come in and they'll say, well, how many treatments do I need? And, all over town, you'll see the banners for, come in for $150 and get 5 treatments and, then you're out the door. Well, for my patients, instead of doing 5, I've got a busy practice. They have busy, active lives. It's hard enough to get them to stay out of the sun, even for 1 or 2 treatments. So with this technology, I can now get the results that I used to have to use 4 or 5 treatments. And patients love it. And it's a great entryway for patients to really improve their skin. So whenever I'm doing a consultation, half the time patients come in thinking they need one thing. And the first thing I say to them is, have you thought about doing an IPL? Because that's going to give you that really fast, beautiful look to your skin. Just doing that makes you look healthier, fresher, younger, brighter. My male patients and my female patients. I have a male patient that he was so thrilled. Now when he sits in the boardroom, he's like telling you need an IPL. He's pointing out everybody that needs an IPL. So IPL, again, is a really great entry point for patients that, are just getting into cosmetic procedures and they want something that's really going to work. Next slide. So in the pre-treatment, some of this we'll go over at other times, but definitely get informed consent every single time a patient comes in for every single treatment. So legally, you cannot, in the state of California, and check with your state, but you cannot get a global consent for everything going into the future. And if you think about, surgery, you wouldn't go into a hospital and say, okay, I'm now going to sign a consent form for every surgery I might have in the next 20 years. So informed consent is vital, and explaining it to the patient so they understand it. And you know, my staff will give them the iPad to sign, but I also go over it verbally, and I always say, do you want to see a printed version of it? So again, just so we're reiterating all the key points, which I will not treat patients with, you know, suntan skin. Some patients will come in, they'll have a little bit of that background sun that you'll see on one of the, actually both of the patients today. But if someone's really actively tan and it's not just kind of their chronic actinic bronzing, I will not treat them. And so patients are warned about that during the consultation. They're reminded of that when they're booking. They're reminded when we confirm the appointment. And if they come in tan, then I will charge them a late cancellation fee, because now we've booked out time, we've blocked the schedule, and they didn't take responsibility for, you know, really prepping their skin properly. If they happen to come in and that day suddenly they're having a flare of a rash or seborrheic dermatitis or some other bad thing, I won't treat in the rash area. Maybe we'll treat somewhere else, or we'll just say come back another time, and I don't charge for those. But if someone does have some active acne, I will treat it, because I find that the IPL really helps not just the post-inflammatory erythema, post-inflammatory hyperpigmentation, but it also calms active acne, and patients love that component, both teens, men, women. We always check to make sure medication-wise that, you know, they're not on any blood thinners, or if they are, which ones. Then I know if I need to adjust my settings, if they're not going to tolerate bruising, which typically I'm not using a bruising setting anyway. It's not necessary with this device. We want to make sure they're not pregnant, they're not breastfeeding, that they don't have any other, you know, medical issues actively. Sometimes I've had a patient come in and they just look awful, and they're like, yeah, I don't feel great. And I'm like, go home. It's not, you know, doing cosmetic procedures when you're not feeling well never makes sense to me. And now with COVID, I mean, everybody's more, you know, hyper in tune with that, but there definitely have been times over the years where, you know, we've sent people home for all kinds of things and saying, just go home and rest. When you're feeling better, then come back and we'll schedule again. Next slide, please. So again, just kind of going over some of the contraindications, and these are things that, you know, we go over during the consultation, and, you know, a lot of times just review it again. So we talked about the pregnancy and nursing, talked about any, you know, medical issues, impaired immune system, people that have photosensitivity disorders, lupus patients, people with dermatomyositis, not your best candidates. I probably ask my patients if they have a history of cold sores like 1,000 different times, just to make sure that we have them on antiviral medication. And so my protocol is to put them on the day before. And then for IPL, since it's non-ablative, I'll do typically like 5 days, whereas with more of my ablative procedures, I'll have them do it for 7 days. If they even think that once in their life they had a cold sore, I tell them to take the antiviral prophylaxis. It's just better to be safe than sorry, because we are using high energy. You can stimulate the nerve, and the worst thing when they're healing is to like suddenly now give them a cold sore, and then you've got to backtrack, and you don't want to get any problems with scarring in the area that you've treated, because the skin is going to be a little bit more delicate. You know, history of abnormal wound healing, keloids. If they come in and their skin is super dry, fragile, I mean, we've selected out most of those patients in the consultation anyway. So again, you're picking like, you know, healthy people that have, you know, sun damage, but they don't have dry, brittle, thin, fragile skin. Next slide, please. Getting a history on Accutane is important. The recommendations have changed a little bit, but I still am sticking with the wait 6 months for treatments after Accutane, just better safe than sorry. And a lot of times the Accutane patients, I mean, some of their erythema and scarring continues to improve for months even after they stop taking their medication. I have many patients like that where we thought we were going to have to do some type of a laser treatment, and as time went on, actually we didn't. And so I think waiting is safer. Vitiligo, of course, that probably wouldn't be the best candidate either. And then, as we said before, this is not for, you know, type 5 and 6 skin or actively tan patients. And then, of course, we do not treat on the upper eyelid or on the lip. When you're next slide, please. You know, when we talked about chromophores and targets in the skin, so tattoo pigment is also a chromophore. So we have, you know, wavelengths that will be absorbed by tattoos as well as by hair. So we always want to avoid those areas. So in the consultation, I always ask about any cosmetic tattoos, any microblading of the eyebrow, any lip tattoo, and then of course if we're doing body treatments or anywhere else where they might have any type of aesthetic tattoo, you're going to avoid that area. Similarly for hair. So when I'm treating men, I always ask them what their shaving habits are. And so if it's someone that always has a close shave and they're like, I don't care if I get some patchy hair loss, whether it's temporary or it's permanent, might even be doing me a favor, that way I won't have to shave as much, then I will treat the whole face. But I will have them shave the morning of the procedure, and if they do have a little extra stubble when they come in, I'll shave again just to get it as close as I can, so I'm not singeing any hair on the skin and burning them. But the majority of my male patients typically are going to treat the nose, cheeks, upper forehead, and temples because, you know, who knows, like maybe someday they're going to want to have a beard, and so you don't want to take that chance of any, you know, patches of hair loss in the beard area. Same thing for the neck. Avoid the eyebrows so you don't singe the eyebrows. Next slide, please. So, you know, this I think is probably one of the older diagrams. And the main thing I was going to show you here is that, again, the darker the skin type, you're going to be a little bit more conservative in your settings. You know, whether to do a test spot or not to do a test spot is always kind of the big debate and controversy. When I was trained over 20 years ago, we were told to do test spots on everybody. Well, the reality is, you know, first of all, doing a test spot doesn't always predict that they're going to have the same reaction on the face, you know, even if you test spot on the neck. Other part of it is patients don't want to have to do a test spot and then wait to come back to have their active treatment. So just be mindful of, again, decreasing your energy settings when you've got the darker skin type. Next slide, please. So we're just going to go through a couple of the before and afters quickly. So this is one of my patients that was very happy with her Lumecca. And, you know, she's a type 4 skin. We treated her with 580 nanometers at a fluence of 8, and eventually we went up to a fluence of 10. And at one of her subsequent treatments, this was after her first treatment, and she was really happy. You can see that little seborrheic keratosis in her mid-cheek that went away like 90%. And she was just really happy with the overall quality of the glow and the look of her skin. We did do a follow-up treatment on her, and I got a little bit more aggressive and went up to a fluence of 10 on her forehead and cheeks, and she did hyperpigment. And so we ended up having to put her on a bleaching regimen. Everything, you know, went away, but any time after that, I always went back down to more conservative settings. Next slide. Another patient of mine that we treated on the hands. We'll do a hand demonstration today, so I'll get into that. But again, a very nice result with the spots on the back of her hands. And, you know, it's the hands and the neck that give everybody's age away. We're all really good about putting our sunscreen on our face and doing everything on our face. And, you know, when you look at people and there's that mismatch between their face versus their neck and chest and hands, that's the giveaway. And I'm seeing a lot more of my male patients, next slide, coming in asking for hand treatments, because again, when they're in meetings and they look down at their hands, they feel like that, you know, makes them look old and sun damaged, and you know, they want to look fresh. A great treatment on this woman's chest, again, using with her skin type, she's probably like a type 2, so using a 515 nanometer filter. And on the chest, you are going to decrease your fluence. You know, here they decreased to 9 and 10. It didn't say how many passes, but they probably did 2 passes. They used the short pulse duration again to have that really good aggressive improvement in the pigment. And you can see even her redness got better, and of course, strong cooling. Next slide. Scars can work really well. Again, I used to use pulse dye laser exclusively for post-surgical scars and acne scars and traumatic scars. And now with the Lumecca, if patient is here for a Lumecca treatment and they also happen to want a scar treatment, I can do it all in one room, one machine, and it's nice and efficient for the patient. Next slide, please. So another great example of pretty typical settings for a type 1-2 patient with a 515 nanometer cutoff filter, 12 joules, and I'm sure it was, you know, multiple passes. Next slide. Telangiectasia works really well. So in this case, they could have done either a 515 or a 580, but they selected a 580 and got beautiful results. Again, trying to target more of that full network of blood vessels. So the longer cutoff filter, the longer wavelength worked really well. And they did 2 passes and they decreased the fluence on the second pass because you do get that buildup of energy. So again, you know, the most important thing with all of these treatments is always look at your patient's skin. So it really doesn't matter what the number is on. In fact, I could have someone put settings in my machine and I could do 1 or 2 pulses. I wouldn't even have to look at the machine. I would know whether they had given me the right setting or not just by looking at the patient's skin and how it's reacting. And that's what you should be doing all the time. Always looking at your patient's skin, because if the setting says one thing, but you're seeing a more severe reaction, or you're seeing excessive swelling that you normally don't see, or God forbid, a blister, you know something's wrong. And if your patient is telling you that they're not feeling cooling or it's feeling way hotter than usual, even with numbing, I mean, they'll feel some of it. So always just, again, look at the patient. That's your endpoint. Next slide, please. So again, more of the same patient with the telangiectasia.
Well, Dr. Roberts, that was absolutely fantastic
Thank you.
overview, and we really appreciate your experience and taking the time for the basic science.